Welcome to this special conference on COVID-19. My name is Rudolf Okonkwo, also known as Dr. Njakịrị Damages. For those who do not know, I play a doctor on an online TV show called Dr. Damages Show. It is a crazy thing that these distinguished medical professionals and other serious-minded people are here today to honor my invitation. Sasha, do you think that they know that I'm a fake doctor? I don't think so. But though when I think about it, I remember that I tried really hard to be a real doctor. Oh yes, I did. I took JAMB twice and I failed to make the cutoff mark each time. Like all serious fathers, my father wanted me to be a doctor. He never asked me what I would like to be. From the time I could remember things, he started drilling it inside me that I would be a doctor when I grew up. Case closed. Well, in my final year in secondary school, I took JAMB. I did. I applied for medicine. My first attempt, I scored 237. That year, the cutoff mark for medicine at the University of Nigeria in Nsukka was 275. I was too far off. My second choice university, the Federal University of Technology, Akure, admitted me to study engineering. Now, the next year, while studying engineering, I retook JAMB. This time, just to ensure I got into the medical field, I lowered my ambition a little. I applied to study pharmacy. This time, I scored 263. The cutoff mark was 267. Now, a study partner of mine at Akure advised me to go to JAMB office in Lagos and see people. I had never been to Lagos and I had no idea how to see people. So I did not go. My friend who scored even lower than me went. He graduated from UNN long ago and is now a pharmacist in Canada. The next year, I applied to go to Russia to study medicine. Everything was on track. I went to the Russian embassy in Lagos and I met the deputy ambassador. I said goodbye to my friends in Akure until a snag stopped my scholarship. Left with 2 years to go, I finished my engineering education. I sensed that my father was not very proud of my engineering. Nobody called him Papa Engineer. If I had become a doctor, my village people would have transitioned from calling him Onyenkuzi, teacher, to Papa Doctor. He wanted me to be a doctor. It didn't help that my junior brother ended up as a veterinary doctor, still short of what my father wanted. From engineering school, I jumped into journalism. And from journalism, I went into all sorts of writings. Even though my father is no longer with us here, I still feel that disappointment in not becoming the doctor he wanted me to be. So when the slightest opportunity came, I became a TV doctor. JAMB, if you're watching, I say, Nto, Nto. Daddy, I hope you're watching. As you can see from the people who are gathered here, I finally made it. Yes, I made it. So, when the pandemic started, doctors across the world were deployed to fight it, even the retired ones. The good people of the Open Society Initiative for West Africa, OSIWA, deployed me too. Why not? Here is a bit of what we did.
I never see the sickness. Now how go take medicine now? No be what you know say they worry you. If you dey sick now sickness where they sick now you go take medicine now.
Not really something that was a bad not really affects me in any bad way.
Yes, I will even encourage my members to allow themselves to be vaccinated.
To start my business. My business to move. For that time, they here the first we are due to the buy and finance.
Lokacin da aka yi COVID-19 kin san kowa riga waje nan mun wahala sosai gaskiya lokacin da akwai COVID-19.
Ni COVID-19 bai dami kasuwa ne. Dun kullum muna sayarwa. Mu ba mu san da COVID-19.
A few moments later.
So you understand our situation. They are disturbing everybody. No social distancing. Today party, tomorrow party. What can we do? Everyday party. So we arrested them.
Thank you, Open Society Initiative for West Africa, for giving me this opportunity. In preparing for this conference, I consulted a lot of real doctors. Most of them are not joining us on stage today. Many wanted to be part of this, but could not due to logistic reasons. Wherever in the world you are watching, I thank you. Some are watching in various parts of the world. I thank you all. Today, we will take a look at how Nigeria handled COVID-19 and how to prepare for the next pandemic. We have brought together doctors, policymakers, patients, NGOs, and media practitioners. They came from America, Europe, and in Nigeria. We hope to have a conversation, share ideas, and hopefully position Nigeria to be ready for whatever comes next. I want to end with something Dr. Gladstone Iwele, a cancer specialist here in the United States, told me when I called him to join this conference. He said a crisis is a terrible thing to waste. He went on to say that the least we should get from this pandemic is to develop a system to know how many people are born in Nigeria each year and how many people die each year. It may be too late if we wait for another pandemic before we set up the systems, policies, and infrastructures that we need. On COVID-19, we missed the bullet this time. It is a good time to buy the shield for the next pandemic. Once again, thank you all for honoring my invitation.
Good morning, everybody. I'd like to welcome each and every one of you to today's Zoom, Nigeria's response to COVID-19 and how to prepare for the next pandemic. This is brought to you today by Iroko Post Media Group. Thank you very much. Today's host, ladies and gentlemen, does not need any introduction, but I'll go ahead and just read a little bit about him. He's a Nigerian-American journalist and writer. He's an adjunct professor of Afro-diaspora literature and post-colonial African history at the School of Visual Arts in New York City. He's also the host of the satirical show Dr. Damages on Iroko Post TV Online, YouTube. He has also been featured in the New York Times, BBC, and the Guardian of London. His most recent books, This American Life Theft, and the Secret Letters of President Donald J. Trump, age 72, 1/6. He's also the author of a book of essays, Children of a Retired God, a chapter of his memoir, Because I Am My Grandfather, which was a finalist in the 2010 John Gullion Literary Nonfiction Prize competition. Ladies and gentlemen, please, let's welcome the man himself, the one and only Rudolf Okonkwo, aka Dr. Njakiri Damages.
Thank you so much. Thank you so much. I appreciate this opportunity. I want to thank everybody for joining us today. This is something very close to my heart, this conference that we're having today. I really appreciate the time that you all took to join us. And we want to talk about COVID in Nigeria, how we handled COVID, and how we are going to prepare for the next pandemic should that happen. I have a prepared remark, but we are so behind in our time, and we want to make sure that we go ahead and get the conversation started. I want to begin by asking the MC, who is Humble Prince. Thank you so much for that wonderful introduction. And I want to use that opportunity to say that can you introduce my co-hosts? We have two panels today. The first panel, we discuss COVID from the perspective of doctors who either they were the people who are policymakers or doctors who were in different profession in terms of we have people that will look at it from the role of researchers and the role of people who treat their patients. We also have patients who were COVID patients who will join us and tell us the story. We want to achieve something today. We want to see if we can learn, have a cross-continental conversation, learn from people who are here in America, patients who suffered from COVID here in America, also from doctors who treated patients in America, and also those in Nigeria. And also we have the media who will tell us the story of how they covered the pandemic. And from the NGO, we're also going to have NGO members who will tell us the role they play in such pandemic. The goal generally is that at the end of the day, we are going to learn something. We are going to come up with something that will help us to deal with the next pandemic. I'm sorry about the hitches we have at the beginning, but we are starting and it's going to be better. Thank you, Humble Prince, for that introduction. If you can just introduce my co-moderator for the first panel, we can start from there.
Yes, thank you very much, Rudolf. We'd like to introduce Dr. Ngozi Obinwane, MD. She's a clinical research professional in Dallas, Texas. Please welcome to today's Zoom. Let's give her a round of applause, ladies and gentlemen. Thank you very much.
Thank you, Humble Prince. Thank you, Dr. Damages, for this wonderful opportunity. I actually reside in Dallas, Texas, as stated, and I'm an MD, graduated from University of Calgary, Nigeria, and currently here into clinical research, and currently acting on the Moderna vaccine, where the PPD and Thermo Fisher scientific collaboration. So I've had a little first-hand experience on the effects and the efficacy of the vaccines throughout the course of the research, and being able to monitor sites and also review the patients. And I must say that I'm glad to be here today. So I hope to contribute a little bit of what I've experienced to everyone's listening. Thank you, everyone.
Yeah, thank you so much. Now let me introduce our first speaker. Our first speaker is Dr. Sani Aliyu. He is a former national coordinator of the Presidential Task Force on COVID-19 and also former Director General of the National Agency for the Control of AIDS. Dr. Aliyu will speak on how Nigeria dealt with the COVID-19 pandemic. Dr. Aliyu, welcome to the show.
Thank you, Rudolf. Thank you, Humble Prince, for inviting me. I'm pleased to see that my colleague and successor, Dr. Mukhtar Mohammed, is online as well. I think it would be useful having him and hearing his perspective, because I left the PTF more than a year ago, back in April last year. So what I'll be saying will probably be mostly historical. But I thought over the next 10 minutes, I'll be talking about three things: where we are now in terms of the COVID response in Nigeria, how did we get here, and in my view, what we should be responding to in the long term. And just to make it clear, I'm no longer in Nigeria. I'm now back in Cambridge. I work as a consultant in microbiology and infection at Cambridge University Hospitals. So some of the things I might say might look like it's coming more from the sort of advanced country perspective rather than a developing country perspective. So where are we now? So far, looking at the website for the Nigeria COVID response, we've tested 5.4 million persons for COVID. We've had about 261,000 cases and about 3,000 deaths, unfortunately. I must say that this figure is it's a gross underestimate of what has been going on in Nigeria. In the first instance, the number of people testing for COVID has gone down significantly over the last 1 year, possibly because of generally from a public perspective, people feel that COVID is no longer an issue. The number of deaths as well is a gross underestimate. But having said that, one thing that is unique with the Nigeria COVID epidemic is the fact that the mortality rate in certain age groups is quite high. If you look at the case fatality rate for people between the ages of 51 to 60, it was about 6.5%. And in fact, if you're above the age of 60, you have a 1 in 7 chance of dying if you catch COVID. That's significantly more than what we see in other parts of the world. In terms of vaccination as well, about 25 million Nigerians have been fully vaccinated, which is only about 12% of the population. So we still have a very long way to go. So when we talk about how did we get here, you probably would remember that the Presidential Task Force was inaugurated in March 2020, and the membership was drawn predominantly from the President's cabinet. It was formed really as a platform for executive decision making, and at the time the PTF was formed, it was formulated very similar to the US approach. In fact, the US government announced its own Presidential Task Force a few weeks before Nigeria did, and we looked at the way they had set their own PTF and decided to model our own PTF in a very similar manner with very high level executive function and a need for a coordinated multi-sectoral response that will ensure that we have a cohesive and effective public health approach, whereby all sectors will be involved and resources can be mobilized fairly quickly. We also had a comprehensive recovery plan post-pandemic, because we knew hopefully that will be around post-COVID. In terms of the coordinated nature of the response, I think the coordination side worked really well, but there were impacts of some of the decisions we took, which in hindsight, I think they were still the right decisions at the time, because nobody could predict how impacted the country will be when it comes to COVID. We could see what was happening then in other parts of the world. The economic impact was the one that I think we probably underestimated, because by the time we did a survey, there was a survey that we did with the National Bureau of Statistics in May 2020, just after we had opened up, which showed that over 2,000 households were interviewed. About 40% of these households, the heads of the households had lost their jobs, possibly because Nigeria is a very informal economy. 80% reported a decrease in their household income. 84% reported an increase in prices, and there was a real drop in terms of access to certain medical measures, such as outpatient attendance, HIV counseling and testing, and even childhood vaccination rates. These were all impacted by COVID. But from a more positive aspect, the multi-sectoral meetings that we had were really helpful when it came to telling people what was going on. For several weeks, we were on TV, on national TV, every day after our meetings, briefing the general public on what was happening, what the COVID numbers were, what the key issues were of the day, and what the decisions were in terms of relaxing. We also deployed a large number of rapid response teams. We made use of what was available in terms of diagnostics. We already had HIV labs across the country, which we mobilized for testing, including the use of TB facilities for tuberculosis for diagnosis of COVID. And subsequently, we encouraged the private sector to set up laboratories specifically for COVID testing, especially from the perspective of travel. We worked very closely with the state governments to activate 131 treatment centers. And at the time COVID came, Nigeria had only about 250 ICU beds. We were able to double that number over the year that we operated, as well as distribute over 200 ventilators and more than 4,000 oxygen delivery equipment. One thing that's not very very clear to the public is the number of people that have been trained as a result of COVID. So, for instance, over 20,000 healthcare workers in Nigeria were trained on infection prevention and control. What's that? That's more to do with how to handle patients and preventing transmission going from one patient to another, such as the importance of hand washing, the importance of isolating people that have infections, etc. And that benefit continues to be felt even after COVID. Because at the moment, we're still able to make use of those healthcare workers to apply the knowledge that they have. Risk communication was also a big thing. We trained over 62,000 persons on risk communication. We worked very effectively with the Federal Ministry of Information and Culture. We also worked with the national, some of the national agencies that had to do with mobilization, for instance, to mobilize over 800,000 community volunteers. Even the person in the village knew about COVID and knew that COVID was real. And we did try to, as much as possible, to address some of the negative press that was coming out in relation to this. But having said all this, what were the issues that we continue to have? And in my view, what do we need to really look at? Well, first of all, we need to learn from the engagement that we had with the private sector. The Coalition Against Coronavirus Disease was a private sector coalition, which was brought by the CBN governor together with some of the bank executives. It mobilized 40 billion Naira, which was the initial target, and we were able to achieve 96% of that target. And most of the funds that came to COVID, government did not have access to this at all. But we were able to tell COVID, this is what is needed. Lagos State require more communication facilities. Kano requires more in terms of ambulances, etc. There's a need to support the provision of amenities, for instance. We were able to tell the private sector what the public required or what the government required to fight COVID. It was a very unique way of addressing a pandemic. And it's something that we really need to learn from as we move forward, especially in the event of a future pandemic. We also had a very effective relationship with the multilaterals. The UN set up a UN basket where all the UN agencies contributed to, including other partners such as Gates Foundation, etc. And they had an annual budget of about $70 million US, of which they distributed about $56 million US. The key contributors were the European Union. But again, these funds did not find their way into government at all. All we did was we worked very closely with them, identified where the needs were, and they were able to put in place implementation arrangements. Testing was also a very important aspect that we need to also realize is important when it comes to pandemic response. We were able to mobilize a lot of testing centers, distribute a lot of testing materials, even though I do agree that the number of tests we're still doing in the country is grossly inadequate. But at some point, we were able to expand to more than 400,000 PCR test kits. And I'm pleased to see that NCDC at the moment are now making better use of rapid test kits, which is what we use in the UK now. We also supported very closely the aviation authorities in terms of travel arrangements. But where do we go from here? Now, my view when it comes to COVID is you cannot get on top of COVID without sorting out your vaccination arrangements. You really can't. And this is where people like Rudolf and my good colleagues online really need to take the fight. We need to get our citizens vaccinated. It's the only way we can get on top of this. Yes, there are variants that are emerging, some of which have the ability to overwhelm the system, but the presentation of illness in vaccinated people is very different. Here in our hospital in Cambridge, we still have people coming in with COVID. Most of them are incidental, but we don't have a single case in the ICU, in the intensive care. People are having a cold, but they are not very sick. And that's what we need to do, because we need to get our economies working again. Closing down is no longer an option. Neither is it an option to isolate people, etc. approach should be to make COVID a mild illness, and that can only be achieved through vaccination. So I will stop here, but thank you very much for inviting me, and I'm sure there will be further questions online later on. Thank you very much.
I'm Stella, and I live in Ibadan. I know that I started feeling feverish, with headache, my head aches. I was having serious body pains. Then I was feeling abdominal pain. And I find it difficult to do anything. I easily get tired and weak. So at first I thought it was the malaria. So I got malaria drugs. So after I got them, I used them, but symptoms still persist. So I felt I just have to see a doctor. So I did. I was asked to treat typhoid. So I treated typhoid again. I just lost appetite. I find it difficult to eat. I find it difficult to do anything. I couldn't even eat my favorite. So it got to say I was advised to go for COVID test. I was like, COVID test. I was scared initially. So I went for the test at close to Secretariat. They call it Health is Wealth. So I got there. They attended to the nurses, everyone there. They attended to us very well. So I did the test. So they were asking me questions. How am I feeling? Why do I want to travel to the country? Why do I want to do the test? I told them I wasn't feeling too well. I just want to be sure if it's actually COVID. So after everything, they attended to us. They get our samples. They did the test, and then they told us if I was positive, they will reach out to us and call. Then if it is the other way around negative, they get a text message. The second day, I saw a call on my phone. So when I picked it, they were for Covid-19 center. I came to run the test, and my test came out to be positive. I was more scared. So they kept calling me often and often, telling me that how am I feeling? Hope I'm fine. Hope I'm not feeling too bad. How am I coping now? And they kept monitoring my life. Like they called me both the day and night. This doctor will call me. This nurse will call me. This person will call me, telling me that they just want to know if I'm fine. I just told them I'm sorry. I don't really know how to explain anymore. And they said they'll come and pick me. And I was more skeptical. When they said they're taking me to isolation center, Olodo to be precise. I've not been to that place before. So I was like, okay. So they said they'll come and pick me in my house. I told them coming to my house will cause a lot of people will start thinking a lot of things. So I told them, can we block somewhere? They came, they picked me, and when we got to Olodo, I was in their ambulance. When we got to Olodo, I was so scared because everywhere looked quiet, there was no noise. So I've been hearing people saying, when you get to isolation center, the next thing is you're coming out dead, like just like when you drop dead, they won't release your corpse to your families, and they treated us really well. You know, there are nurses, there are doctors, they come, they do vitals twice a day, in the morning and in the evening. They gave us good food. It was balanced diet. It was a complete meal. I really want to say kudos to the caterer, to all the doctors there, Dr. Afonja, that guy, they did a great job. Dr. Ogundokun, Dr. Olulano, they did great job. And they took us like we are part of their life. They come to us, they preach to us, they tell us COVID is not the end of the life. They tell us we will definitely be all right. And all the nurses, all the cleaners, they cleaned everywhere. Everything was just as if, the only difference is that we're not with our families. But that place is really good. And when you notice you are feeling feverish, your head aches, and you are thinking maybe it's malaria. If you have treated malaria once and you are still feeling the same way, please go get a COVID-19 test. Just try and go for it. And the doctors out there at the COVID center, isolation, Olodo, they did a great job. Their CMD address us very well. They tell us in case you don't like this food, in case you are not convenient, this is not too good for you, in case you fell your bed, you don't like it. They are sent to everyone. They say like this one is that one is rich with your palm. They treat us equally. And once again, please always remember to wear your mask. COVID is real. My name is Stella once again, and I live in Ibadan.